And thank you, Sandra, for the nice introduction. And welcome to all our international and Swedish guests. I'm happy to see so many of you here and that you've taken the time to come and hear as to what are we doing in the scope of precision medicine. Right, so my topic was current and future perspectives. I chose actually to include the definition of precision medicine again, since many of us used both the personalized and the precision medicine terms, as well as precision health. My personal favorite is actually the precision medicine, because we here at SciLife Lab aim to bring molecular precision into medicine. And this is the definition that we all know from the EU health ministers from 2015. And it also, we use this as our definition of precision medicine here at SciLife Lab in our strategic roadmap. So I've chosen this visual because I think it also displays the different data types that are truly needed for next generation diagnostics and for technology and data-driven precision medicine. And it's good to remind us all, even if SciLife Lab is a vast infrastructure, that we only work on stuff coming out of the body. So we work on ex vivo materials. So we don't do whole body scans. That was done at, for instance, Center for Imaging Research that you visited yesterday. So that's good to remember. Oops, sorry, I went too fast. I won't either delve into genomics. You heard plenty of that from Rickard Rosenqvist Brandell, and you know that the Genomic Medicine Sweden was initially started at the clinical genomics platform at SciLife Lab. But we have 9 other platforms providing expertise and technologies. So we have really the potential for true multimodality from SciLife Lab. And I've, of course, chosen 2 of the spatial transcriptomics pictures here to display that we can really do single cell, even subcellular location of proteins and within our technology facilities with our expertise. So this is to display the potential. So the capabilities of precision medicine was recognized 3 years ago as one of the societal challenges that SciLife Lab wanted to contribute to. And as already mentioned, the data-driven life science program also has 4 different topics, of which one is precision medicine and diagnostics. And Janne here will talk more about that after me. But like Sandra alluded, it is a 12-year initiative. It is funded by the Knut and Alice Wallenberg, and it's mainly a talent recruitment program. So we have around 50 fellows that are going to be recruited in this program, 39 already in place, as well as PhD and postdoc programs, including collaborations with industry. Then we have the strategic focus areas, and of course I today place the precision medicine on the top, because this is one of them. But in addition, we also focus on planetary biology, pandemic laboratory preparedness, and drug discovery and development, which is our oldest capability. Some of you have seen this list before. This is my wish list. So rather than putting it in the end, I put it in the front, because this is all our responsibilities. We are all needed to achieve this. And this is, of course, colored by the need from a research infrastructure as to what would we want. So I don't think there's actually anything that you wouldn't recognize on this list, but let's run through it quickly. So broad digital consenting, the opt-out. In Sweden, we have a digital system called 1177. That's one example of how it could be done. We also need systematic sample collections, broad ethical permissions, and biobank. So the processes of getting sample flows together needs to be aligned. Data provenance. So I've used this term from the art world, and you know what provenance means, is that you actually know what happened to a sample and link it to a data set so that we get into the clinical fair that Anna also mentioned yesterday. Then we need the data infrastructure, so secure handling of research data. So we often talk about healthcare data and forget about that the research data also needs to be structured, high quality, and findable and reusable. We need larger studies. So we can't keep on funding a few million euro projects. That is for open research, and that is also needed. But we will also need specific strategic funding to really do the systems change that we have ahead of us. And as said, real-time data generation and sharing, this is really at the core. And this thing needs to be done despite every country's regional division, and it's been done in federated countries such as Germany, so it can be done in Sweden, I believe. But I'm going to now go into what SciLife Lab can contribute into this landscape and what is our role in that. So we have also written a strategic roadmap, which you can find online. And here are the 4 main objectives of that, which includes partnerships, increased accessibility, and promote the awareness at SciLife Lab for data and technology-driven research. And then also enhance awareness around us on this. Initially, we have been a team of 5 people in the strategic core to drive this task. And I will shortly now summarize as to what are the generic achievements we've been doing for the past 3 years, and then delve into some quite specific projects that we are pushing now to actually go from strategy to operation. So for the establishing the effective partnerships, you can see Genomic Medicine Sweden, of course, being the prime target here, but also additional international collaborators such as Cancer Core Europe, and then the DRUP-like trials network across Europe, and including also Testbed Sweden and Barncancerfonden. Increase accessibility to SciLife Lab's infrastructure, specifically for translational research and clinical studies. So these are the project funding, the external projects that I will talk about more in a minute. And then also promote technology and data-driven research at SciLife Lab. So here we've had specific calls. Sorry, that was my animation going in the wrong order, that I also talk about more. And then, of course, community awareness. So we have a series called Clinical Talks, 30 minutes on Fridays, where we invite both industry, clinical and clinical translational researchers. And we participate in the Swedish political arena called Almedalen. So let's go into what happens at SciLife Lab in concrete terms for precision medicine, and how are we to prepare the technology platforms for technology and data-driven precision medicine. As you all know, genomics is a fairly stable method. There are, of course, many new methods in genomics also coming. So we need to consider technology readiness level of the platforms that we have. We also need to consider what type of materials are needed. Some of them work on N-of-1, and some need larger cohorts, and some work in real time, and some needs retrospective data. That needs to be considered. So we need to consider how sample handling and sharing of material between our technology platforms, and can they really do clinically meaningful timelines? And do they use data standards so that we actually create interoperable data? And of course, why is this important? We want the clinical fair data also to be generated at our infrastructure in a clinically meaningful time frame. And here we have had the technology development call, which is to help our platforms actually mature some of their assays towards clinical use. And we initiated this year 10 of these. So then we have the letter of interest call, which is actually a co-creation for the sample sharing and turnover times that we have initiated 5 pilot projects that I will talk or display shortly. So the letter of interest call is actually a collaboration or a co-creation where we need to improve our ability for the novel diagnostic technologies for multimodal data generation, and to actually be prepared to support clinical trials better in the future. So that means we're working on things like real-time biobanking, meaning sample flow, not only storing samples in biobanks, but actually getting them out. On initially now multi-omics data generation, but not forgetting about multimodality. Then metadata models, together with these researchers, we're looking into what are they doing, how are they actually using FHIR, OpenEHR, and OMOPS, and how can we make a standard that goes all the way into the SciLife Lab technologies. Because as Anna mentioned also yesterday, some of the technologies don't even have standards today. And we still need to ensure that the data is collected correctly and that the quality is high. And then, of course, clinical decision support. So this is our trio, or the 5 pilot projects that we have selected. They are, of course, funded by small means to begin with, and looking into different types of cancer modalities, but also a cardiovascular disease domain. So then how do we prepare bioinformatics and the data center? So we have things in place, platform services. We have lots of tools at NF Core, our site for collecting a lot of the bioinformatic analysis pipelines. And we also have data center and the DDLS program, really heavily supporting data management aspects. But all of these need to tie together. So how do we really, make these things available for clinical researchers and for precision medicine in particular? And you can see, again, my list of why is this important is very similar to the sample flow. So you can't really distinguish between sample flow and data management in that sense. In this domain, we have been lucky to get funding from the digital program in a testing and experimentation facility for health, the TEF Health. And I thought it would be good for all of you here to be aware of this body, or this project, which is to provide technical and scientific support for health AI providers and notified bodies. So we're going to be the scientific and technology support across Europe for SMEs, for small and medium-sized enterprises towards AI. And I don't think I need to explain as to why AI is also relevant for precision medicine, but I'll highlight that throughout my talk. This is a big project, 60 million euros in total. It's driven by Professor Petra Ritter at Charité, and we are 52 partners in this project. And Vinnova is kindly funding this project. And the Swedish node lead is Daniel Lundqvist, whom you met yesterday. So we're actually talking about true multimodality in that respect, including also whole body imaging as well as the molecular technologies. So the disease focuses of this project are these 4, including neurotech, cancer, cardiovascular, and intensive care. And there are currently 4 testing and experimentation facilities in Europe, so there will only be 1 in health, and Sweden is a big part in that project. But there's also 1 in manufacturing, in agriculture, and in smart cities. And we talked a lot about regulations. We were regulating ourselves to death. So within the TEF Health project, we have actually had the opportunity to have workshops also with the AI Act legislators, and the project is written into the AI Act as a supporting body for this type of scientific and technology support. So I still need to go back. So I think we're all aware of this, and this is the legislative terms I've added there. And this is, of course, needed, and the main goal is to increase the trustworthiness of AI in general. And what does that actually then entail? So we know there are these risk categorizations of AI tools. And I like this visual. I picked it up from a review that I have the link in there, just showing like the terms and the type of paperwork you will need depending on the risks. So you can see that if you are really in the high risk category, you do need to do your accreditations and certifications in the correct way. And we as an infrastructure are trying to learn this ourselves, like how can we support this now, as I assume all of you are similarly doing. Then there was a question yesterday as to how do we leverage all of this European funding coming into Sweden. And this is one way that we're trying to do. So you all know about the digital program, and now you heard about one of the projects called TEF Health. But there's actually other large projects such as the genomic data infrastructure, the European cancer images, and then the Health Data Sweden. And these are all funded, and Sweden is part of all of these programs. And the same legislative issues actually are urgent for all of these. So we decided to create a coordination project where actually the lawyers that are currently aware and on top of these things can meet each other and talk so that we use the same resources. So in this coordination project run by Sevim Barbasso-Helmers here at SciLife Lab, we work on the LC matters. We also talk and try to catch up on each other's technical infrastructure. It's the things we can reuse. And also talk about the important semantic interoperability in that domain. So I think this is one way of leveraging successful EU calls on a national level to get benefit back. So then back to TEF Health. It's on purpose that we have the schema of that you recognize usually from fridges and washing machines, is that we try to really do to certify and improve the technology readiness levels of the SMEs in this domain. So we will work with technology readiness levels 6 to 8, so close to implementation. And of course try to, again, similar to as to precision medicine, make the bridge to the healthcare providers. And this is done by providing services within the physical testing domain, within virtual testing, meaning data and data infrastructure, and then also on consultancy. And examples of physical testing facilities you can see here, they really are multimodal in that sense. So it's not only SciLife Lab, of course, providing services, but it's across Europe, hospitals, clinical research institutes, and such. So we're currently building our knowledge graph, which you can also find online for displaying all of these physical services. But they also include the virtual testing facilities. You can go in and look at the home pages. And then consulting services such as clinical trials, help, and certification and quality management, and so on, just to give you a few examples. And how will this service be given? So you can, for full cost price, already actually start using the services of TEF Health. But for the subsidized services, you will need to apply through calls. And you can find more information through the QR code here. And the aim is then to help validate and certify tools in this way for faster implementation. I'm coming to the end of my talk. I still wanted to highlight the infinity loop that we have seen in most of the presentations already yesterday. And I've added the samples and metadata on top because they can't go without each other, but then also data and AI. So these are some of the key aspects that are really needed for this infinity loop to happen. We have now built an operational team along with the strategic team, so I'm not in this alone, and I want to acknowledge the team. They do a lot of hard work in a very complex domain and really are the pioneers trying to push for a good and sustainable solutions, not benefiting only one research project, but as an infrastructure. And here, of course, we're very grateful to the funders that help us pave the way and do this from our... And with that, I thank you and invite Janne Lehtiö as the next speaker. But thank you, Malin.
Thank you. Thank you so much. It's good that you're getting ready, Janne, but I'm thinking we have time for a question, so we keep ourselves
active,
awake and engaged. Question? You're overwhelmed.
I ask a question. Yes, so good morning. My name is Gianni Derico. I'm the head of project management office at Toscana Life Sciences, and we are leading the work package 5 of the European Partnership for Personalized Medicine. Thanks a lot for the presentation. That's wonderful, and I apologize. I was a few minutes late. I forgot my rucksack in the hotel. I have one question. So you have mentioned that there is besides the last project, you also collaborate with private entities, and if that, do you collaborate with the companies or organizations that use federated data approach, and how it works, the collaboration with outside entities?
Yeah. So currently at SciLife Lab, we often transfer the data to the owner, actually. So we have services for sharing of sensitive data. As of a generic federative data infrastructure, we don't have that in place just yet.
But if someone offers you that kind of approach, so like they come, they just analyze data, give you, I mean, according to the collaboration, the outcomes, is that possible, or? No?
So since we lack our own sensitive data infrastructure right now, but it is available in Sweden, so yes, it is possible.
And I can just add to that. So in the 1 Million Genome Initiative, and you saw the genomic data infrastructure. So NBIS, the National Bioinformatics Infrastructure, they are part of Elixir. So the European, the Federated European FEDA Genome Phenome Archive.
Yeah,
I always forget that. So at least the national node in a future for accessing genetic data in Sweden is right now building on the FEGA.
Yeah.
But of course, we don't know what's installed moving forward. Yeah. But there are secure processing environments sort of being developed. But it's still at the beginning of the journey.
Yeah, it's still fragmented in that sense. Yeah. So you have those services, but.
Okay, thank you, Paivi.
Thank you.